Good morning, everyone, or good afternoon, or good evening, wherever you may be in the world. Hello and welcome. My name is Stephanie Jackson. I'm the Associate Director of Hybrid Programs here at Georgia Tech. I want to welcome you to this installment of our Safety Speakers Series. We do expect this to be a very interesting and engaging session on human and organizational performance with Kirk Mahan. He is the Director of Safety Excellence at Georgia Pacific, and he will discuss how people, work systems, culture, processes, and equipment interact to shape organizational outcomes. In our session today, Mahan will explore how to become a true learning organization by adopting HOP principles. Embracing this approach to transform learning will lead to better protection of workers. Now, if this is your first time here, or maybe you're returning, I want to remind you that this Safety Speaker Series is presented by our Professional Masters in Occupational Safety and Health. So next, I would like to introduce Professor Paul Schlumper. He is the Director of Safety, Health, and Environmental Services here at Georgia Tech and a lecturer in the Professional Masters in Occupational Safety Health program. He's going to let you know a little bit about our program and then introduce our speaker for today. Paul.
Thank you, Stephanie. Good afternoon, everybody, and thank you for joining us. I know we have both PMOSH alum and current students, as well as some folks interested in PMOSH that are joining us today. So let me tell you a little bit more about PMOSH for those of you that are not familiar with it. PMOSH stands for the Professional Masters in Occupational Safety and Health. And as you can see from the slide, it is a multidisciplinary graduate degree program, and it's a two-year program where you basically the bulk of the work is done off-site or virtually, if you will. So you can live anywhere in the world and participate in the PMOSH program. There are some site visits that are required both at the beginning, middle, and end of the PMOSH program. But as you can see from the slide, it's tailored to working professionals. You go through the program as a cohort. So a group of you will go through this process together, learn together, experience the information together, and at the end go through a capstone project together. So when you finish up, you will have a graduate safety practitioner designation, as well as, of course, a very coveted Georgia Tech professional master's degree in occupational safety and health. So we'll tell you a little bit more about PMOSH after the program today. But of course, any of us will be glad to answer any questions you have about PMOSH either today or in the future. So let me go ahead and get right into our program. We're very pleased to invite back Mr. Kirk Mahan. Kirk has been a speaker in this series before, and he's going to talk about human organizational performance. I've had the pleasure of spending many years working with Kirk, so I feel a little bit awkward reading his bio. I could probably tell you more just from our experiences, but let me give you some information about Kirk. Kirk is with the Georgia Pacific Safety Support Center in Atlanta. He's been with GP for 27 years. And before GP, he worked here at Georgia Tech. That's where I spent most of my time with Kirk. He worked here for 9 years, both with the OSHA Training Institute Education Center and with the On-Site Safety and Health Consultation Program. Kirk is a registered PE and a certified safety professional. He, among other things, he serves on the Occupational Safety and Health Steering Committee for the National Safety Council Network. He's a senior member of the Institute of Industrial Systems and Engineers, a professional member of ASSP, and a member of the Texas A&M School of Public Health Industry Advisory Board. Kirk holds a bachelor's degree in industrial engineering from Georgia Tech and a master's degree in business administration from Georgia State University. So once again, thank you, Kirk, for joining us. Take it away, Kirk.
Well, thanks, Paul. I appreciate that, and I really appreciate you not telling all the real stories about us, especially maybe a bus ride with a man named Griff one time. So let's see. Do I click share again, or do y'all see my slides?
We
I
see
think
your
I clicked.
slides. We see
Oh,
your
you
slides.
do?
Mhm.
Okay. Well, very good. All right. So I appreciate y'all letting me be with you again. this year to speak, and I'm going to cover the same topic that I did last year because it's still an emerging safety concept across most of industry, and that's human and organizational performance. But just real quickly, a little bit about Georgia Pacific. We are a Georgia-based company. It started 100 years ago next year out in Augusta, Georgia, as a little bitty sawmill, and it's grown over the last 100 years to about 30,000 employees and 150 sites or so, primarily across North America and most all of that in the United States. You can see we got kind of three major business units that we operate in. So basically, anything you can make from a tree, we tend to make that. So everything from pulp and paper products to building materials as well, and then some packaging materials also. And then here are just some of those consumer products that we do manufacture and sell as well. So hopefully your kitchens, pantries, bathrooms are all full of these products, so I can continue to be employed. And then just a quick little look here at our footprint, kind of all over the country. But as I said, make things out of trees, so the plants tend to be where most of the trees are. So that's why there's that proliferation in the southeast and then out on the west coast. All right, so let's get into some of the content. Again, it's going to be human and organizational performance, also known as HOP. So when I say HOP, that's what I'm talking about. And so this became a really important part of Georgia Pacific's safety strategy about 2015 to 2017. And the reason I give you two dates there, we first introduced the concept to our leadership and our facilities around that 2015 point, so a little over 10 years ago, and it didn't take. They weren't ready for it. Our organization wasn't ready for it. And so we waited a couple of years and reintroduced it about 2017. And by that time, we were a little bit more mature in our safety journey. And so we were more successful with implementing human and organizational performance after a couple of years. So if this is a new concept to any of your facilities, I would encourage you not to get discouraged if it doesn't take off the first time. And certainly we're not done. This, like most things in safety, is not a finish line that you're trying to reach, cross, and stop. This is something that you're trying to get better at every single day. And so the other couple of pieces of our safety strategy, if you will, this little three-piece puzzle, um, the leadership piece, really that's encapsulated or most well seen through our safety vision statement that's shared with all of our facilities. The next piece, the critical hazard risk reduction, that is kind of those true SIF and SIF potential events. So serious injury or fatality events, or those events that have potential to lead to serious injuries and fatalities. And so about let's say it was probably about 2012, 2013 or so. We did a really deep dive. We went through about 300 to 400,000 data points to see what are the kind of the handful of things leading to most of our serious injuries and fatalities. We found out there were about five areas that were leading to more than 90% of those serious injuries and fatalities. And so we created a really strategic emphasis around that, but we still were not where we wanted to be. And so that's when we discovered this concept of human and organizational performance. We felt like that was really the missing piece. And like I said, so about 10 years ago or so, we started introducing this across GP. Now, this slide, I've taken out a lot of animation that were in these slides, but I can kind of walk through these for us. Now, you might notice a name down there in that bottom right corner. It's Conklin. That's a fellow, a Dr. Todd Conklin, that actually came out of the Los Alamos National Laboratory out in New Mexico. And he is one of the real thought leaders in the space of human and organizational performance. And he's actually the person that Georgia Pacific brought in to really help us to form our thoughts and our strategy around HOP. He's spoken to our senior leadership a number of times, and many of you have probably heard of him before, but I will reference him kind of throughout this. But this graph is specifically attributed to him. And so if you look at kind of the historical view of safety, and you think about the number of accidents that were occurring, say 3 to 4 decades ago, over on that far left-hand axis, that's when a lot of regulations started coming out. It's when companies started issuing a lot of rules and policies, and they were successful. Those regulations, those rules, those policies did help improve workplace safety. And so, as you run through kind of into 30 or so years ago, those those number of incidents started dropping, but they did start to plateau as well. And so that's when management concepts started getting introduced. Things like risk management systems or safety management systems, or even things like behavior-based safety, if any of you are familiar with those different safety strategies and concepts. And so again, after those were introduced, there was a period of time that the number of accidents in industry started to drop again. But as you can see down at the bottom, that vertical, or excuse me, the horizontal axis there, that it started to plateau again. And so what we started realizing was that there's something missing out there. And even though we're approaching, let's say, no injuries, no serious injuries or fatalities, still these things happen, even in excellent companies, even companies that have an excellent safety um, program, an excellent safety effort. They have a wonderful culture in place. There are still these anomalous events. And so, how can we start to address those? And that's where the human and organizational performance concepts come into place. And as you've already probably gathered, Georgia Pacific did not invent these concepts. These were actually created back in the 60s and 70s, even. These concepts came out of those industries that when something goes wrong, it is in it is catastrophic to communities, to counties, to states, to entire countries, even perhaps. So if you think about industries like the nuclear power industry, or if you think about the military, often the deck of an aircraft carrier is used to explain some of these concepts. Those areas that really have to have a high reliability organization. And then it even started finding its way into the automobile industry and even the medical profession. Because I bet almost all of us on here have had a surgery before, or you've had a loved one that has gone in for surgery. And we typically hold physicians in kind of the highest regard in our society. We think about just how much education, how much experience they have before they actually get to practice their profession. And so these highly trained, highly skilled, highly educated people often will come into that surgery ahead of time and just write on the body part that they're going to be working on with a Sharpie, because even these highly educated, highly experienced individuals that are going to be performing these surgeries, they still make mistakes as well. So if someone that has that level of intelligence and training is prone to make mistakes or is capable of making mistake, what chance do I have? So we all make mistakes, and that's what human and organizational performance is all about, is how to build in some capacity so that when those mistakes occur, it doesn't cost someone their life, or it doesn't permanently alter their life. So often the auto industry is used as an example in human and organizational performance. And if you think about just kind of the last 100 years of the automobile, back to the early 1900s when the automobile was first being widely adopted in this country. And so way back then, there were very few miles being driven, but the number of deaths per mile driven was huge. That's what that right hand, or excuse me, the left hand red line is just the number of deaths per mile driven was practically off the charts there. although the number of miles people were driving was very, very small. And of course, over the last 100 years, the number of miles driven has just grown and grown and grown, while the number of deaths per mile driven has just plummeted. And that's a great thing. Well, what are some of the reasons for this? Is it that they made us drivers better? No, that's actually not the case. They actually made the cars safer. And if you think about it in kind of a pure dollars and cents, they need me to survive my mistake of crashing the car so I can go buy another car. So trying to make me a better driver is going to be really tough, particularly for an auto company, but they can do a lot to build in some safety capacity into that automobile. And so if you just think about, and I won't read all of this to you, things that have improved are things as simple as roads and tires to all of the safety features that are in a modern automobile. It's not that they've made me safer, they've made the car safer so that I can recover from any crash that I might be involved with. So let's just kind of take a quick little comparison here of traditional safety, the way that we all were historically taught, and in fact, the way that I used to teach safety versus safety differently, safety 2.0, human and organizational performance, whatever label you want to put on it, we're really talking about HOP. So the first thing that we were taught traditionally was that workers are the problem to be fixed, and we fix safety by making workers better. Well, I don't know about you, but I'd really prefer that not be my job. Any of you who have had children, you know it's kind of hard to fix people. It's kind of hard to make them better. So it's easier if we can make the environment and the system better. So what HOP teaches us is that workers are not the problem, they're actually the problem solvers. The people doing the job are the people who know best. So we should gather information from them rather than telling them what to do. Next, traditionally, we must tell workers what to do and perhaps more importantly, what not to do. And so you all know as well as I do how kind of unsuccessful that has been across all the whole history of the safety profession. So HOP teaches us that we don't tell our organizations what to do, but we ask them what they need. What will help make this job easier to get it right and harder to get it wrong? And then these last 2 points for traditional and HOP are a little bit provocative because traditional safety, how we have traditionally measured safety, is the absence of accidents. So if you had an incident rate of zero, for example, then we assumed you were really a safe facility, and that may be true, but it also might not be true. It might mean a number of things. It might mean you're lucky. It might mean that you're not familiar with record keeping rules. It might mean that you're cheating on record keeping rules. So just because nothing bad has happened, just think about driving to the grocery store. If you get there and you didn't crash, how do you know you were safe? And so, can we just say, well, I didn't crash the car, so I must have been safe? Or was I just really lucky that all those red lights and stop signs that I went right through just didn't result in a crash? So, that's what makes measuring safety pretty tough. So, a better definition of safety is not the absence of accidents, but rather the presence of capacity, and specifically the capacity to fail safely. So it's kind of back to that word I used a bit ago. It's when something goes wrong. It's not if it's going to go wrong, it's when it goes wrong or when those controls fail. What keeps me from losing a life or permanently altering a life? So we have to make sure that we're not just relying on a single control. We've got to layer those controls up and actually have enough adequate recovery controls so when the primary ones fail, we've got a way to save that life, uh, save that or prevent that injury from happening, and then save the life in the type of response that we have. So, just a few things to keep in mind, some footnotes before we go into the individual concepts. This is what organizational human and organizational performance is. It's a shift in thinking about safety that helps us learn and improve. It really relies on being a lifelong learner. Um, we have to reach out to those that know better, those that are new doing the job to try to learn and improve. It's a journey that takes time. Like I said, we started in 2015. It absolutely did not work. Tried again 2 years later, started to work, and we're still not where we want to be, but we're in a much better spot now than we were 10 or even 20 years ago. It's a way to expand our thinking beyond why to how. So, one of those traditional safety investigative tools that we've probably all used was kind of the five why. Just continue to ask why until we get to this so-called root cause. But really that starts to feel kind of like finger pointing or blaming or individualizing the outcome of an event when it may be more productive for us to ask, how could something like this occur? So rather than trying to uh, point or pin something on an individual, we try to find out about the systems and the environment that were involved. We focus on building an error tolerant system with those layers of protection. And so I'm sure you've all seen like the Swiss cheese models before, where you try to make sure none of the holes line up. That's kind of what this is talking about, or an error tolerant system. If you've ever been bowling, or if you ever do go bowling with me, I can almost guarantee I'm going to put those bumpers up on the sides. That creates an error tolerant lane for me. So I'm not gutter balling every other roll. I'm actually able to get the ball to hit some of the pins. That's kind of a silly, simple example of an error tolerant system. It's the presence of safeguards and that capacity to fail safely. And then let's jump down to what it's not. It's not a program or a rule or a standard. We tell all of our sites that this is something you will never be audited against. There's not a HOP standard that GP uses where we go out and say, "Hey, you're kind of weak on this level right here, or this element right here, or let's see your written HOP program." We don't ever audit for HOP. It's more of a way of living or a way of thinking. It's not this paper program that you can go and audit against. And it is certainly not a single solution to SIF prevention, serious injury or fatality prevention. The thing that we do try to teach folks, kind of the elevator speech, if you will, is that bottom little blue pill there. It makes it easier to get it right and more difficult to get it wrong. So let's take a look at the five concepts and all the way um, back to Todd Conklin, and when he and his peers were starting to put together these concepts, they had these five concepts. And Georgia Pacific, we tend to have to put our own little spin on most anything. So we had our own little version of the five concepts, and we've actually even updated them since these that I'm sharing with you right now. We just recently updated them, but the concepts themselves are basically the same. The wording is just a little bit differently. So, just real quickly here, the five concepts: people make mistakes and blame fixes nothing. We seek learning opportunities that allow us to build capacity to fail safely. Context influences behavior. We'll talk a lot more about what in the world's context. Violations of rules are rarely intended to cause harm and often make sense at the time, and how leaders respond matters. So let's take a look at the first of those. People make mistakes and blame fixes nothing. I think that's fairly intuitive, but um, I can guarantee there's no one on this call that hasn't made a mistake in their life. And in fact, if we use me, I can guarantee I've made a bunch of mistakes today. And there's no telling how many more I'm going to make. And so yelling at me is not going to make it better. It might make the person yelling at me feel better, but it's probably not going to change my behavior a whole lot. Now, here's kind of an interesting twist on a traditional statistic that I bet most of us have heard before. That little pie chart over on the left, we've probably all heard, and I know I've certainly said that really 90% of all of the incidents that occur are human error. Well, that may or may not be true, but statistically speaking, if you really start to dig into that 90% of human errors, there's really a lot more telling information. And up to 70% of those human errors were actually induced by the system we put the human in. It wasn't just that uh, Kirk's a bad employee, and if we just get rid of Kirk, then all our problems are going to go away. It's that if we replace me, the next person's probably going to do the same thing because they're working in the same system, and the system is set up for failure of the employee. So even though that small pie chart may be true, it's not really very helpful. What's more helpful is that larger pie chart that shows even most of those human errors are system-induced errors. And then there's this historical economist, Edward de Bono, that said mistakes arise directly from the way the mind handles information, not through stupidity or carelessness. So I won't ask, even hypothetically, if any of us have ever said, what are you, stupid? We may have thought it before, but hopefully we don't say that much. But really, it's not the limitation of the person. It's more than likely the limitation of the system or the environment that we're putting the worker into. So let's just pause for a second and think about what's going on in there. What are some of these brain hazards and where do these errors come from? And so I'm certainly not a neurobiologist or anything like that, but did want to talk about a couple of the parts of the brain specifically. Let me just go through the animation so we get to it. Let me went too far. There we go. So if we think about the frontal lobe, the front of the brain, that's kind of that slow thinking part of the brain where you're having to concentrate on doing a test or something like that. Think about uh, your child came home with all the new math problems, and now you've got to relearn how you learned how to do math and work on theirs. And so you've really got to concentrate on what's going on. That's the frontal lobe of your brain. The back part is that fast thinking part of the brain. That's kind of that automatic part. That cerebellum is what's all hardwired into us. So things that we don't even have to think about anymore. So think about as an adult, we don't really have to think about tying our shoes. It just kind of happens. I don't even really remember tying my shoes this morning, but hey, look at there. My shoes are tied in on my feet. I didn't think about it. But my 2-year-old granddaughter, you know, we haven't even started talking about how to tie shoes yet. She's still using Velcro. But when that day comes on trying to teach her how to tie shoes, she's going to have to rely on that frontal lobe because this is a brand new skill that she's never had. And so we all go through this based on our experiences, our educations, our backgrounds. We all come to the table with something different, and we rotate or we transition between those two parts of the brain. So even though we might be in a same role at a company, there are times where those employees have different experiences. Think about how many new hires you've got, and then you might have that 40-year employee that's about to retire. Well, they're at different places. A lot of the things that 40-year vet employee is doing are out of that cerebellum, whereas that new hire, almost everything they're doing is up there in that frontal lobe. It's not been hardwired yet. So this is kind of an interesting model. This one comes out of Rasmussen, and I really, really like this model a lot. And so what it is showing us is how much attention you have to pay to a task based on how familiar you are with that task. So this goes along with the example I was just given of the newbie versus the 40-year employee. So if I've been here for 40 years and this is what I do all day, every day, I really don't have to think about it. I don't have to pay a lot of attention to it. I'm in that fast thinking skill bucket. At the other end of the scale, I'm newbie. I started on Monday. I've never run a drill press before in my life. I have no idea what's going on. I've got to really pay attention. I'm there in that red knowledge bucket, that slow thinking. But then, even as I gain experience, or maybe I've got to go back and do a task that I used to do, but I'm just not familiar with it now, I'm kind of in that middle zone. Now, where this really gets interesting is where you start looking at the number of mistakes. Now, this is not necessarily injuries, it's just the number of mistakes that are made. So, even that highly qualified, done this a million times in my life, they're going to mess up about one out of every 10,000 times they do that task. So, overall, that's pretty good as long as that task doesn't lead to a fatality. Now, they're in the middle as we're transitioning between this. This is about a 1 in 1,000 times that that error is going to occur. Now, I won't ask you to say it out loud or even put it in the chat, but just think about what do you think the next box is going to be? This is that newbie. This is the person that you just brought in off the street. They've never done this before. And after they do something uh, to make a mistake, often we just kind of shake our head and say things like, well, what were you thinking? Well, the brain science tells us that it's 1 out of 2. Every other time they're going to do it wrong. That is just an amazing statistic to me. Every other time they do it, they're going to make a mistake. Again, it's not going to hurt them necessarily. It's not going to kill them, but it might. 1 out of 2. And so, if we realize that brain hazard, we can start to build in some more capacity for our new hires or for anybody even moving into a new role. We may need to provide a lot more coaching, a lot more oversight. We may need to use an apprenticeship model. We may need more physical controls in place because the brain science is telling us every other time they're going to make a mistake. And we've all been in that bucket before, and we will probably all be in that bucket again. So here are some specific, and this is certainly not an all exhaustive or all inclusive list of biases or brain hazards that are out there, but these are 6 of the really common ones that we all deal with. Perceptual blindness is, think about this one kind of came to mind when, and Paul will know know this, but in the city between where I live and where Paul lives, they added some stop signs about a block off of the town square. This is probably 5 years ago. They added these stop signs that had never been there before. Well, I'm just driving to the ice cream shop to get some ice cream, whipping through the town there, and my wife says, "Hey, you ran stop sign right there." And I'm like, "What? There's no stop signs here." Well, I've got all these years of experience telling me there's no stop signs here. Well, guess what? The city added stop signs. I'm thinking ice cream. I'm not looking for signs that have never been there before. And we can have that same sort of thing happen in our workplaces. Micro sleeps, I bet we've all had this one before. Um, Think about a lot of us are probably remote now, but think about when you did have to drive to work every day and then you drive home at night. Think about how many times at the end of the day you ended up in your garage and you don't really remember driving home. You just were kind of on that autopilot and your brain just kind of shut it down as you were driving home. And hey, look at there, I'm here already. That's an example of microsleep. So those veteran employees, even though they're in that 1 to 10,000 ratio, they might fall into some microsleeps, and those can really be deadly. In fact, if you look at kind of the statistics that we've had, um, our fatality history is that it's the newbies and the really experienced folks. I mean, that's not an absolute, but if you tried to trend it, it's either low experience, low number of tenure, or very tenured employees. And so that could be a reason that that occurs. Situational blindness is where you're sent out to do something. Let's say we're going to go do a lockout audit. And so I'm out on the floor just looking for locks. Well, I might walk right by a crew that's working 30 feet up in the air without any fall protection, or I might walk right past a forklift driver that's not wearing a seat belt, or I might walk beside a confined space that they don't have a confined space attendant. They don't have any ventilation. They don't have any monitoring, but I'm looking for lockout. And so that situational blindness just takes my concern or my focus off of anything else that could go wrong. Optimism bias, I am certainly guilty of this. Just about every weekend, I'll kind of make a list of what I'm going to work on this weekend. I'm going to cut the grass and change the oil and paint the gutters and blah, 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 blah. And all of a sudden, here comes Monday, and how much of it did I get done? Maybe one or two things. I always overestimate my abilities. Confirmation bias is just simply where we're looking for information to verify my own thoughts or my own opinions. Kind of in the everyday world, we see this a lot in politics, where I don't care what the other side says, they're always wrong, my side's always right. And of course, that's not true, but we can do that in the workplace too, where I'm only seeking information that will support whatever my assumption or presumption might be. I mean, think about monitors. We might have some hazardous material monitors in place, and we know what the range is that they go off, and so the monitor's not going off, so I assume everything's good. Well, maybe the level of exposure exceeds the upper range of the monitor. Well, I'm in a really dangerous situation, but it's not going off, so it's telling me everything's good. So we just have to be aware of things like that. And then fundamental attribution error. This is kind of a fun one. Um, think about when you've ever been cut off in traffic. Somebody just cuts off trying to get off at that ramp or uh, get into your lane because there's a construction site up ahead. And what do we think about that person? We're all just furious with that person. Maybe we shake a fist or maybe something even a little bit more naughty than that at that person. Well, I bet we've all cut somebody off in traffic before, unintentionally even. Well, I just made a mistake. I'm a good driver. I am so sorry. That was just my bad. But if you do it, you're an idiot. You're the worst driver in the world. That's what fundamental attribution error is. It's never going to happen to me. It's going to happen to you. It's going to happen to somebody else. It is not going to happen to me. So we just have to be aware of these and really all other biases that we encounter. So if we've got all these horrible brain hazards in our head that we really can't do anything about it, what do we do? Well, we have to just acknowledge that errors will happen and we can't fix people. We can't fix the way that we naturally are wired. And we won't eliminate these biases because that's just how our brains are wired. But we can anticipate that this is human nature and build in some more of that capacity to fail safely. So we just have to recognize that the possibility of these biases occurring exist and then build the system that can tolerate those errors. So here's another Todd Conklanism for us. You can either blame or learn, but you can't do both. Well, of course, the one we want to do is learn. So if we go into an event, post-event, saying, well, who did it? We're kind of already done learning. We really need to start to find out about how could things like this occur, or how does the system work every other day that this bad thing didn't happen. Let's do more of that and less of today. Whoops, skipped a little ahead there. Now, this is a model that we've adopted in GP that Chevron actually helped us put together. And this kind of puts those errors and violations, those mistakes, if you will, into three different categories. It kind of puts a label on three different situations. So, an error is an action or an inaction that unintentionally results in some undesirable outcome, or it's an unintentional deviation from the rules. Whereas a violation is an action or inaction that you intentionally deviate from rules. Now, it's not necessarily a bad thing, even though violation, we kind of hear that and we think bad things, but just think about how many times have any of us ever noticed that we're speeding? We're exceeding the speed limit in our car driving somewhere. I bet there have been times where maybe you've got a rental car and you got that nice fancy Mustang convertible and you're whipping down the road and all of a sudden you look down and look at there, I'm doing 90 miles an hour. This thing just drives so smoothly and boy, I need to slow down. Well, that was an error. You didn't mean to exceed the speed limit that much, but it happened. Did anything bad happen? Hopefully not. Hopefully you didn't crash. Hopefully you didn't run somebody off the road. Hopefully we didn't get a ticket. So were we safe? I don't know, but we did have an error. Now, violation, on the other hand, although it sounds bad, we all probably have sped on purpose before. Just think about maybe you're going on vacation. It's a nice, clear day. The car's in great shape. It's got new brakes, new tires. There's not many people on the road. So even though the speed limit's 70, I'm going to set that cruise control for 80 just because I'm ready to get on that beach. I bet we've all done things like that before. Did it make me a bad person? No. Did I crash? No. Did I get a ticket? Usually not. But still, it made sense at the time why I did it. And then the last one, hopefully you won't encounter this ever, but it's sabotage. It's where someone intentionally does something, violates something to cause harm. So just think about maybe an arsonist or something like that. Then, yes, that's sabotage, and that should result in strong, immediate punitive discipline. The other two, it's not taking punitive discipline off the table, it's just saying we need to learn first. If we fire this person and never talk to them, let's say it's a lockout violation, for example. You caught me without a lock on the machine and I'm in there working. Well, 100%, you're out the door and you don't ask me why. You're just replacing me. There's a pretty good chance that my replacement's going to do the same thing. Maybe talk to me about, hey, why did this happen? How did this happen? Let's learn first. And, you may find out that I'm just not going to follow the rules ever, then yeah, maybe discipline is appropriate at that time, but learn first. Don't just lose your opportunity to learn because these things like cardinal rules, some of you may have these cardinal rules that if this rule's broken, there's no discussion, and lockout is often one of those. Well, what if it's that 30-year most senior best maintenance person you've got and they broke it? And I bet we're all struggling to find qualified people, particularly in maintenance these days, but our rule says we got to get rid of you. Well, we've not learned anything, and we've let 30 years of experience walk out the door. There may need to be action taken, but we don't know. We just said we're at the mercy of our rule. So here's a model that we can use to kind of look at it. And I know this is very busy, so I'll try to go through it quickly. The one on the left is kind of the way we've traditionally done it. We have an accident. I'm on the circle part here. We have an accident. We do an investigation. We then compare what we learned against the rules, and then we take action. Typically, we fire somebody, we suspend somebody, we make everybody go through training again, we write a new rule, something like that, and then we say, okay, boy, I'm done. And then we're surprised when it happens again, which the better way to do it would be on the right hand side where we have that event. Let's learn. let's talk to the person that was injured. Let's talk to other people that work in that role. Let's talk to people that supervise that. Let's learn about what's happened. Now let's evaluate what we've learned against our system and then take some changes. Let's involve other people in developing what those changes should be. And then we implement those and we continue to look for failure. We look for gaps, things that we may have missed. And so we're just constantly adding that capacity to our system. All right. The rest of these will go a little bit quicker. So here's the second one. We seek learning opportunities that allow us to build capacity to fail safely. So Conklin tells us that events aren't predictable, but the conditions that create events are. So just simply what that means is that if I knew I was going to cut my hand off today at work, guess what I wouldn't do? I wouldn't cut my hand off because I wouldn't go to work or I wouldn't pick up a chainsaw or I wouldn't do whatever it is. So we can't rely on that predictability of the actual event, but we can look at a system, we can look at the conditions, we can look at the context, and that'll give us an idea that, hey, something bad might happen here. And a good tool that we can use is known as the bow tie. And the bow tie is made up of these three parts. The blue side is the prevention controls, the red side are recovery controls, and then right in the middle is the work execution or where we lose control. So if we just think about, I don't know, let's say maybe like a cell phone. One of the first things that we do when we get our brand new cell phone, we put a case on it. That case is a recovery control. That case doesn't stop me from dropping my phone, but it says when you drop your phone, maybe it won't be destroyed and you've got to go get a new phone. Now, we would like to put some prevention controls in place. You know, they tell me don't drop my phone. My mother told me, hey, don't drop expensive electronics, but still, we drop our cell phones. And so we've got to have some kind of recovery over there. And that's true for the workplace too. If we put all of our attention to the prevention controls, remember those words. It's not if, it's when. When those prevention controls fail, what is left, what recovery controls are left that keep this event from becoming a serious life-altering or life-ending injury. Now, this is a little bit provocative here that we're saying we're willing to accept some minor injuries if it stops someone from dying. Let me let that soak in for a second. It says we're willing to have a lesser injury if it saves a life. That's what the recovery controls are for. It's not necessarily going to mean no harm, no injury, but it means I'm still alive. And that's a concept that may be tough to implement or to introduce to your facilities. And that's one of the things that and the discipline were some of the things that were really hard for us the first time we tried. But this is a very valuable tool. Third is context influences behavior. And what do we mean by context? You know, if an event occurs, we can say, well, who did it? And then just be done. Or we can say, you didn't lock out and be done. But we lose all of this other information that is so much more valuable that's upstream. So, for time's sake, yeah, I'll go ahead and talk about this. We want to ask better questions. And so, one of the things that we do is instead of saying why or who, we ask about their day. We ask, what does a good day look like? What does it look like when nobody gets hurt doing this job? What makes doing this job hard? What day is really easy for you and what day is really hard for you? And so trying to learn some of that context, you may find out that that employee, maybe they've got a newborn at home, maybe their significant other left them, maybe they've got a parent that they have to take care of, maybe who knows what. There may be all these other things that are going on with that employee that we just don't know about. Or maybe they've tried to fix this machine a dozen times already, and it's just so unreliable that I put my lock on the first 11 times, but this 12th time, I was just so frustrated that I didn't lock it out again. That's some pretty good information that we can improve our system. Whereas if I don't see a lock, you're out the door, I don't even know the machine's been worked on for 12 times. I don't know it's a bad machine. Fourth concept, violations of rules are rarely intended to cause harm and often make sense at the time. So this is the model that we typically use for this concept, and it's called black line, blue line. The black line is work as anticipated. This is your SOP or your procedure. The blue line is what actually happened. And so just think about if you've ever gotten a piece of furniture from like an IKEA. I bet one of the first things, if you're like me, you throw the book away. You don't even read the instructions. You just start putting pieces together. That's the blue line. The black line was that book that came in the box with the furniture. The blue line is how I did it. And when I get to the end, sometimes it looks really good. Sometimes I've got the doors on backwards. So that's what the red line is. That's the hazard line down there. And we're trying to keep a big gap between that blue line and the red line. But wherever that blue line starts to drift down from the black line, from the rules, that's what we call normalization of deviation. And so all of a sudden, the blue line actually becomes your black line, and that's taking you much closer to that hazard. So here's just kind of a silly example. This was a bike crossing path in a community where they had a number of bikers that were nearly hit by automobiles. So they thought, well, here, this is what we'll do. We'll put this crossbar so the biker has to get off and then walk their bike through this turnstile. So now they're more likely to walk it across the road. Well, that was the black line. Here's your blue line, this worn out dirt path through the grass where all the bikers decided, I'm just going to go over here. So we've got situations like this in our own facilities where we might think, hey, this is the way to do it. The workers are going to tell you the way it gets done. Oh, sorry. My fingers got a little twitchy there. So here's what we can really do for operational learning. A number of tools that we use. Humble inquiry is another word for this is industrial empathy. And this is where you just ask people about their jobs. You ask people about their day. You ask people about what's going on in their life. You're really trying to walk that mile in their shoes, if you will, to find out what makes this job just awful for you. What does a really bad day for you look like? But also, what's a good day look like for you? So let's try to have more of those good days and less of those bad days. The better questions, I gave you some examples of those. Ask the how instead of the why. The blue line reviews we just saw, the bow tie. And then there's ultimately this thing called a learning team. And the learning team is kind of a resource intensive group that gets together for a really important discovery. And so we do these, if we have a really significant incident, we'll do these, and we really prefer to do it pre-event if there's something that we're really struggling with. And so the way that this happens is you get together and you just talk about how normal work is done. And then you kind of put those common concepts together and you form a problem statement. And then you brainstorm on that problem statement and come up with some ideas that you're willing to go try and fail quickly. So they don't have to be perfect, but we want to try them. If they work, great, let's implement them. If they don't work, get it out of the way. Let's move on to the next idea. We have had a lot of success with these learning teams. And I'm going to keep going again for time's sake here. This will be a good example. So just in going through those events where we're trying to do operational learning, let's say we've had an employee's hand pulled into a pulley. And what we might find out is, well, the employee entered a guarded area at someone else's request. And we might just end our investigation there, where a better questions is going to tell us about that normal work. So tell me about your work. What's a good day look like? What's a bad day? What near misses have you had? What's predictable and so forth. And so what you might then learn is, hey, my normal partner wasn't here. The supervisor was unaware of the practice. We've been working on this clutch. This is an 8-month operator and so forth. So you're going to get all this other learning rather than just replacing the employee. You're going to find out about what needs to be done to fix the system. And then lastly, how leaders respond matters. And so here are a few mistakes that leaders can make. Looking for a single root cause, that really goes against the concept of that context, all the other stuff. If we're looking for a single thing to fix, often that ends up being the worker, and we really don't get any better. We don't improve our system. Believing not following the procedure is why the event occurred. Well, of course, that's why it occurred, but that doesn't help us learn. That doesn't help us get any better. Thinking they should have known better. And I'm guilty of this too. There's a lot of times that you're kind of shaking your head at an event, but it made sense at the time. Just think about any time where you've ever been injured, either at home or at work. Whatever you were doing probably made sense at the time. If you'd known it was going to lead to an injury, you wouldn't have done it. Next, not bringing the planner and the worker together. So, us as safety professionals, we as safety professionals, we all have a lot of great ideas, but we need to talk to the people that we're trying to implement our ideas on and come together for a better solution. Rushing to fix. We've certainly been guilty of this. We've had some arbitrary rules in place that, hey, if we've had an event, we want you to get a safety alert out within 24 hours telling us what you're going to do about it. Well, 24 hours, I may not be done learning within 24 hours. If it's a serious injury, I may not have access to the injured within 24 hours. So if we make these arbitrary rules to just rush to say we're done, we're not going to get to the place we need to be. And then assuming we know why the event happened. We're all pretty smart people. Think back to those biases, the optimism bias, the fundamental attribution error. Those biases can affect us as safety professionals, thinking we know more than we really do. We need to go about and have those better questions. And so, a few things that we've done, we put together these little pocket cards. That's what one of them looks like. I've got one here on my desk that we can carry, and it's got all the better questions on there with it. And then also, it reminds us of what those concepts are. And then the last thing that I'll share with you here is this is a new model that we've started looking at. I said this is not a program and it's not something we audit against, but we do measure how mature we are, and certainly individuals, sites, businesses, and then the company all kind of have our individual levels of maturity. But this is a model that we use to just kind of see, are we getting better or are we sliding back in our maturity in implementation of HOP? So wanted to share that with you. If you do get on this journey with human and organizational performance, it's very fulfilling, but it takes time. It takes some time. So that's all I've got for you today. Paul, anything else?
Thank you so much, Kirk. As always, that was outstanding. That was great information. Thank you so much. We're almost out of time, but I think we can try to take maybe one or two questions. Stephanie, does that sound okay?
It does. It does. We have one from David Hood
Uh,
or a
yeah,
comment.
go ahead. Is that a comment? I'll read it. It says the
Okay.
knowledge rule skill ratio was very interesting. It's actually a question as well. Is there a way to account for instances where mistakes increase when tasks are transitioning from knowledge to skill? For example, when teaching people to drive a manual transmission, I often see a regression where there are more instances of missing a gear or grinding as someone is starting to get to that point where they don't have to think about the shifting as much as when it was brand new. I want to get your thoughts on that, Kurt.
Yeah, that's a great example. And actually, I started to use the example of a manual transmission because for years I drove a manual haven't driven it in a while. I could probably still drive a stick, but I bet it's going to be kind of clunky the first time I get back in there. But as I was saying there, we kind of drift along that line between all three of those buckets. As we get away from something, we kind of float between them until we have that aha moment again. So I think your example of grinding gears, that's a perfect example of that transitioning across the different buckets.
Very good. Maybe one more. I don't know if this is a question.
We have
Um,
a question in the Q&A. Since leadership plays a big role regarding the response, is there an instance you can share where there was difficulty to get buy-in from the top?
Maybe read that to me one more time.
Sure. Since leadership plays a big role regarding the response, is there an instance you can share where there was difficulty to get buy-in from the top?
Okay. Um, Rather than share a specific example, I'll tell you kind of a theme of things. Leaders that are new to Georgia Pacific and are not as familiar with human and organizational performance, they tend to go back to the traditional ways of discipline first, um, kind of blaming the worker, if you will. And so we kind of constantly deal with that where we have to be intentional about exposing new leaders, new to Georgia Pacific leaders to human and organizational performance because traditional management practices tend to be contrary to some of the hop concepts. So I would say that's a fairly common one that comes up. Um, Something that all hop companies that I've heard about kind of have to struggle with that, deal with that, fighting the either the old habits of all of us or the practices that have been brought in from folks that just have not been introduced yet.
One last question. Do you have any KPIs to measure this process?
Ooh, that's a good one. We struggle with that because, like all leaders, oh, we want to know, we want a number or a red, green, yellow. How are we? Are we, where are we there? That's why we came out with the maturity model, was so we could kind of anecdotally figure out which one of those five levels we were in. I know it's not a numeric thing, it's not a red, green, yellow, but we have tried to measure um, training, how many people have been through our HOP leader engagement sessions, how many have been through HOP site coach, how many learning teams have been conducted, how many blue line reviews, how many bow ties, those types of things. So we have tried to quantify some of those as metrics. I would say really the better metric for us has been qualitative and anecdotal.
Okay. All right. So, Kirk, I don't know if you're there. Can you load the slide deck? I do just want to remind people we do have one more um, upcoming session this year for our speaker series. It is coming up on April 16th with Zach Ledner, Director of Partnerships at Voxel. He will join us for a session on how safety leaders can use AI to objectively strengthen safety programs. And you can scan that QR code on the screen right now to register for that if you would like. That's on April 16th. That'll be our final session of this cycle. And then lastly, I just want to remind you you can scan the QR code to get more information about our PMOSH program if you're interested in applying. We are now accepting applications for our fall 2026 cohort. So you can certainly scan that QR code to go to the URL to learn more, register for our next information session, ask any questions that you might have about the PMOSH degree. Note that the deadline for fall 2026 is April 15th, 2026. And so that is what I wanted to share with you all tonight. Any last things? Thank you all again for joining us.
Stephanie,
Thank you. Yes.
Stephanie, there's a Nathan Martin. He put something in the chat. Possibly Mr. Main would like to address that. Suggestions to influence old dogs that might be retiring or leaving soon. Younger, newer employees appreciate HOP, but difficult to get 100% buy-in.
Yeah, I find that I I'm constantly studying, and I encourage others to do that too. Todd Conklin has an amazing podcast. If you're into podcasts, um, he has a number of books out. They're actually simple reads. They're all written not like an academic at all. They're written like I don't know, maybe like I wrote it. It's kind of how conversational it is. They're all about 100 pages. You could read it on an airplane trip practically. There are a number of communities out on all platforms of social media. There are HOP events all around the country. National Safety Council puts on a HOP summit every year where companies that are practicing HOP come and give very hands-on, realistic, real-world examples. Um, I would say that that's probably as good as anything I can tell you. I wish there was a magic wand for people my age, but it really is get into those books and just be a student of human and organizational performance.
Thank you again for that. Let me thank you again for joining us, Kirk, for
Glad to
expertise
do it.
in your time today. I want to wish everyone else a good day. We appreciate participating in our speaker series, and we hope that you'll join us again on April 16th for our next event. Have a great day, everyone. Thank you for your time. Bye bye.
Thanks, everyone.